Good afternoon to all. I am Durga, working as a nursing lecturer in Emmanuel Arthur College of Nursing, Nattala. Today we are discussing about the topic of the care of vulnerable patients. Definition of vulnerable patients. A patient who is or may be for any reason unable to protect and take care of him or herself against significant harm or exploitation. Assessment of vulnerable elderly. Neurological status, psychological and mental status, ability to meet activities of daily living, general physical assessment, assessment for suspected nutritional and functional risk, assessment for the risk of fall injury, skin integrity assessment. Assessment of vulnerable young children. General conditions, medical or surgical conditions, assessment for a suspected abuse or maltreatment. Following type of patients can be identified as vulnerable patients. It means who are called vulnerable patients. Below 12 years, above 65 years, terminally ill patients, patient with intense and chronic pain, women experiencing termination and pregnancy, patient with emotional psychiatric disorders, patient receiving chemotherapy, patient whose immune systems are compromised, patients suspected of drugs and alcohol dependency. These patients are called vulnerable patients. Problem faced by vulnerable patients. Vulnerable patients are prone to face following problems during their stay in the hospital. First one, fall from bed or in washroom or while transporting from one place to another. The physical and mental limitation make it difficulty for these patients to avoid falls. Second one is harm due to medical errors such as wrong medication, wrong diet, etc., as they are unable to watchful about the care being given to them. Third one is neglect and abuse and similar other behaviors by some staff. Fourth one, infringement of their rights such as privacy, informed consent, confidentiality, respect, etc. Fifth one is occurring of healthcare associated infection as these patients may not be observant about infection prevention practice. Then care of vulnerable patients. First point is vulnerable patients so identified can be given a patient ID badge of a orange color or a safety first labeled on their medical files for the information of healthcare staff. Fall leaf is displayed on the patient cot. Then fall risk assessment. One of the prevalent risk all vulnerable patients face is the risk of fall. Hence, as a prevention measures, all patients identified as vulnerable must be assessed for risk of fall. Morris fall scale can be used for this purpose, which give a risk score. Necessary measures can be taken for a patient. Safety of the vulnerable. They shall be accompanied by an attendant while going to washroom or any other areas. The washrooms that they use must have grabs for bars, anti-skid mat and call alarm system. While they are on bed, safety railing should be put up in place to prevent fall from bed. While placing transported on wheelchair or stretchers, safety belt shall be put up. Then they shall be accompanied by the attendant while going to washroom or any other area. All healthcare provider will maintain a safe environment related but not limited to equipment, wheelchair, bed rails, mobility needs, fall precautions. All healthcare provider will encourage family involving and supporting in care delivery, education and decision as appropriate. The discharged patient will be discharged with follow-up advices. Documentation of fall events. Record the incidents including description of event. Report the incidents through the hospital incidents reporting system. A fall has occurred when factors contributing to the fall, outcome of post-fall assessment, what additional protective measures have been put in place. Then environmental issues, activities that aim to reduce environmental risk include decreasing obstacles and clutter, night lights at bedside and toilets, stabilizing bed and bedside furniture, having crossing bar inside the toilet, all repaired to be attended without delay. Medications and mobility medications. Activities related to medications include assessing patients receiving laxatives, diuretic and hypertensive, etc. Non-skid food wears. Providing physiotherapy. Instructing patient to rise slowly. Assistance while walking for patient. Repeating activity limitations instruct to patients and family assisting patients during transfer. Then mental state, bed rest, mental state. Altered mental status is one of the common identified risk factors for falling, and the intervention include reorientating confused patient regularly, orientating patient to the hospital environment, keeping confused patient near nurse stations. Use family members to be with the confused patient all the times bed rest. Interventions that aim to reduce the risk of falling while patients is on the bed include ensure bed is low in position, ensure bed is locked, ensure bed rails are up in position, ensure patient can reach necessary time. Then wheelchairs and chairs. To prevent fall involving wheelchairs include use safety straps or seat belts in chairs. Ensure support to prevent slipping from chairs, selecting suitable chairs for sitting. Orange color ID bands to identify vulnerable patients. And call bell. Food stool call in bathroom. Side rails and fall leaf grabs for safety belt in wheelchair. These are the care of vulnerable patients. Thank you.